So in this ABDM, Ayushman Bharat Digital Mission, there are 4 important milestones to be achieved. The first and foremost milestone is to have a digital ID for all the hospitals, which has been already created. After this, you are all well aware that all the doctors have been registered. So that's the second step. So every doctor is having their own ID. So all the hospitals are digitized. Now all the doctors are having an health ID. Okay, now all the doctors are having their ID. Next, the third step is to create the health ID for all the citizens. So for all the citizens of the country, particularly now in Andhra Pradesh, the process is going on. So the process is going on. Now we are aware that మన దగ్గర అందరి దగ్గర ఆధార్ నంబర్స్ ఉన్నాయి, ఆధార్ కార్డ్స్ ఉన్నాయి. Similarly, every citizen will be provided with an health ID and a health card. Okay, health ID and a health card, national health ID and national health card. సో ఈ నేషనల్ హెల్త్ కార్డ్ తో ఎక్కడికి వెళ్ళినా సరే, ఇండియాలో ఎక్కడికి వెళ్ళినా సరే ట్రీట్మెంట్ తీసుకునే వీలుగా ఇది ప్రావిజన్ కల్పిస్తున్నాము. సో దాని ప్రకారంగా ఈ హాస్పిటల్ సాఫ్ట్వేర్ అనేది డిజైన్ చేయడం జరిగింది. ఓకే, దాని భాగంగానే ఈ పర్టికులర్ ఈ హాస్పిటల్ సాఫ్ట్వేర్ అనేది డిజైన్ చేయడం జరిగింది. సో ప్రస్తుతం ఇప్పుడు మనకి ఏఎన్ఎం వర్కర్స్, ఆశా వర్కర్స్ ఎవరైతే గ్రౌండ్ లెవెల్లో పనిచేస్తున్నారో వాళ్ళు మొబైల్ బేస్డ్ యాప్ ద్వారా అందరికీ కూడా హెల్త్ ఐడి క్రియేట్ చేయడం జరుగుతుంది. సో కాబట్టి మన హాస్పిటల్కి వచ్చే పేషెంట్స్ ని ఆ హెల్త్ ఐడి ఉంటే తెచ్చుకోమని చెప్పండి. దాంతో మీరు రిజిస్ట్రేషన్ ప్రాసెస్ ఈజీ అయిపోతుంది. జస్ట్ ఒక నంబర్ ఎంటర్ చేస్తే చాలు, పేరు, ఊరు, నంబర్ ఏమి ఎంటర్ చేయాల్సిన అవసరం ఉండదు. ఓకే, సో దట్ ఈస్ ద థర్డ్ స్టెప్. సో థర్డ్ స్టెప్ వచ్చేసి ప్రతి సిటిజన్స్ కి కూడా మనం నేషనల్ హెల్త్ ఐడి అనేది క్రియేట్ చేయాలి. ఫోర్త్ స్టెప్ వచ్చేసి ప్రతి పేషెంట్ యొక్క డేటా, హెల్త్ డేటా డిజిటైజ్ చేయాలి. that will be called as health record. Okay, so every patient ప్రతిసారి హాస్పిటల్కి వచ్చినప్పుడు తన హెల్త్ రికార్డ్ క్రియేట్ చేయడం డాక్టర్ గారి పని. ఓకే, సో ఆ హెల్త్ రికార్డ్ ఎలా క్రియేట్ చేయాలి, హెల్త్ రికార్డ్ ఎలా షేర్ చేయాలి అనేది మీకు ఈ ట్రైనింగ్ లో చెప్పడం జరుగుతుంది. ఓకే, దీని తర్వాత లాస్ట్ లో ఎండ్ పాయింట్ గా ది హెల్త్ రికార్డ్ ఆఫ్ ఎ పేషెంట్ is the proprietary of a patient. So until and unless a patient gives a consent to share the data, you will not be able to see the data at all. So first and foremost, ఎవరైనా సరే హెల్త్ ఐడి, హెల్త్ రికార్డ్ షేర్ చేయాలంటే పేషెంట్ కన్సర్న్ కంపల్సరీగా తీసుకోవాలి. ఓకే, సో ఆ పేషెంట్ కన్సర్న్ ఎలా తీసుకుంటారు అనేది కూడా మీకు చెప్పడం జరుగుతుంది. అండ్ లాస్ట్లీ, ఎవ్రీ పేషెంట్ కి మనం హెల్త్ ఐడి క్రియేట్ చేసిన తర్వాత ఆ హెల్త్ ఐడి ఆర్ హెల్త్ రికార్డ్స్ ఎలా చూస్తారు పేషెంట్స్, ఒక యాప్ ద్వారా చూసుకుంటారు. ఆ యాప్ పేరు ఏంటంటే ABHA, ఆభా యాప్ అంటారు. ఓకే, ప్లీజ్ నోట్ చేసుకోండి. ఆ యాప్ పేరు వచ్చేసి ఆభా యాప్ అంటాం. ఆయుష్మాన్ భారత్ హెల్త్ అథారిటీ, ABHA. ఓకే, గూగుల్ ప్లే స్టోర్కి వెళ్ళి ఆభా యాప్ అనేది మీరు ట్రై చేస్తే ఈ యాప్ అనేది మీకు డౌన్లోడ్ చేసుకోవడానికి వీలుగా ఉంటుంది. సో ఈ యాప్ ద్వారా మీ హెల్త్ ఐడితో రిజిస్ట్రేషన్ చేసుకొని ఓపెన్ చేసుకుంటే మీ హెల్త్ రికార్డ్స్ అన్ని కూడా కనబడతాయి అక్కడ. ఓకే, so this is the gist of the entire workflow and the process which we are trying to accomplish in Andhra Pradesh right now. So all the hospitals are now installed with e-hospital. So all the instances are up and running, and I would like to put on record some of the good, best performing hospitals in AP right now. More than 40 hospitals are doing OPD registrations. 40కి పైగా హాస్పిటల్స్ OPD registrations చేస్తున్నారు. ఇంకా దాదాపుగా ఒక 18 హాస్పిటల్స్ ఎంతో చేయాలి. డైలీ బేసిస్ మీద రికార్డ్స్ రావట్లేదు, దయచేసి అందరూ కూడా ఓపీ రిజిస్ట్రేషన్ స్టార్ట్ చేయండి. బెస్ట్ పర్ఫార్మింగ్ టాప్ పర్ఫార్మింగ్ హాస్పిటల్స్ ఆర్ జీజీహెచ్ విజయవాడ, సెకండ్ వచ్చేసి జీజీహెచ్ కాకినాడ. ఓకే, సో దీస్ ఆర్ ది అండ్ థర్డ్ వచ్చేసి ఎస్విఆర్ఆర్ రుయా హాస్పిటల్ జీజీహెచ్ తిరుపతి. ఓకే, దీని తర్వాత జీజీహెచ్ నెల్లూరు, దీని తర్వాత డిహెచ్ ఏలూరు, దీని తర్వాత ఏరియా హాస్పిటల్ నర్సీపట్నం. ఓకే, జీజీహెచ్ శ్రీకాకుళం, దెన్ జీజీహెచ్ ఒంగోలు. సో ఇట్లా చాలా హాస్పిటల్స్ బాగా పర్ఫామ్ చేస్తున్నాయి, ఓపీడీ రిజిస్ట్రేషన్స్ చాలా బాగా పర్ఫామ్ చేస్తున్నాయి. జీజీహెచ్ విజయవాడలో అయితే నంబర్ ఆఫ్ కౌంటర్స్ పెట్టారు. విజయవాడ, దాని తర్వాత ఎస్విఆర్ఆర్ జీజీహెచ్ లో 5 to 6 కౌంటర్స్ పెట్టేసి ట్రై చేస్తున్నారు. వాళ్ళు కూడా చాలా బాగా చేస్తున్నారు. 5 to 6 కౌంటర్స్ చాలా మంచి ఆప్టిమం రిజల్ట్స్ వాళ్ళు ఇస్తున్నారు. సో అదే స్ఫూర్తితో అందరు హాస్పిటల్స్ కూడా మినిమం మాక్సిమం నెంబర్ ఆఫ్ కౌంటర్స్ పెట్టేసి ఆ కౌంటర్స్ ద్వారా కంప్లీట్ గా ఓపీడీ రిజిస్ట్రేషన్స్ అనేది చేయటం స్టార్ట్ చేయండి. ఓకే, సో ఓపీడీ రిజిస్ట్రేషన్ స్టార్ట్ అయిపోయిన తర్వాత క్లినికల్ మాడ్యూల్స్ ఇంప్లిమెంట్ చేయాలి. క్లినికల్ మాడ్యూల్ ఇంప్లిమెంట్ చేస్తేనే హెల్త్ రికార్డ్స్ అనేది జనరేట్ అవుతాయి. Okay, so now we will go into the actual demonstration of e-hospital, and I request Mr. Saurav and Rahul. They are the national e-hospital trainers, so they will be imparting you the training, and in between we will be intervening in between in Telugu. Okay, yeah, Rahul, you can start. Saurav, you can start.
Thank you, sir. Let me share my screen. So, sir, screen is visible to all participants.
Any few hospitals, sir, please respond.
Sir, visible and audible, sir.
Ekkada?
Okay.
West Godavari, sir.
Sir, GGS Nellore visible, sir. Guntur visible, sir.
Okay. Vijayawada?
Okay. Okay, sir. Thank you. Now our e-hospital application is hosted on cloud, so any hospital can access this application on web browser using the URL, production site URL, ehospital.gov.in. Once we will hit the URL on browser, we will get this page, logging page. From here, just we have to move the cursor or click on that logging link on the right side of the page. Once we will click on the logging button, then user will get the pop-up page where we have to enter the username, which are being created by the nodal officers. So all the doctors and the nurses and the operators have their own ID. Using that ID, they can log in the application, and as per the roles and responsibility provided by the nodal officer, they will get the module access.
సో మీ క్లారిటీ కోసం ఆల్ హాస్పిటల్స్ లో నోడల్ ఆఫీసర్స్ ఉన్నారు. నోడల్ ఆఫీసర్ ఈస్ అట్ ద లెవెల్ ఆఫ్ RMO ఇన్ ఎవ్రీ హాస్పిటల్, అండ్ దిస్ నోడల్ ఆఫీసర్ ఈస్ ద అడ్మినిస్ట్రేటర్ ఫర్ ఈ హాస్పిటల్ ఫర్ ది లోకల్ హాస్పిటల్స్. మీకు యూజర్ ఐడి క్రియేట్ చేయాలన్నా, డిపార్ట్మెంట్ క్రియేట్ చేయాలన్నా, క్లినిక్ క్రియేట్ చేయాలన్నా, ఏది చేయాలన్నా నోడల్ ఆఫీసర్ గారు మాత్రమే క్రియేట్ చేయగలరు. అండ్ రెండో ఇంపార్టెంట్ పాయింట్ ఏంటంటే, మీ యూజర్ ఐడి క్రియేట్ చేసిన వెంటనే మీ మొబైల్ కి ఒక లింక్ వస్తుంది. మీ మొబైల్ కి ఒక లింక్ వస్తుంది, పాస్వర్డ్ సెట్ చేసుకోమని చెప్పేసి. సో మీరు బ్రౌజర్ లో ఆ లింక్ ఓపెన్ చేసేసి మీ పాస్వర్డ్ సెట్ చేసుకోవాలి. సిస్టమ్ లో పాస్వర్డ్ సెట్ అవ్వదు. సో దయచేసి మీరు మీ మొబైల్స్ లో చెక్ చేయండి. ఇన్ కేస్ మీ దగ్గర ఆ మెసేజ్ లేకపోతే నోడల్ ఆఫీసర్ రిక్వెస్ట్ చేసేసి మీ పాస్వర్డ్ రీసెట్ లింక్ పంపించమని చెప్పండి. ఓకే, మళ్ళీ మీ ఐడి చెప్పేసి వాళ్ళు మీకు ఒక లింక్ పంపిస్తారు. మీ రిజిస్టర్డ్ మొబైల్ కి మీకు లింక్ వస్తుంది. సో ఆ లింక్ ద్వారా మీరు పాస్వర్డ్ రీసెట్ చేసుకొని ఇప్పుడు ట్రైనర్స్ చెప్పినట్టుగా ehospital.gov.in వెబ్సైట్ లో ఓపెన్ చేసేసి రైట్ హ్యాండ్ టాప్ కార్నర్ లో లాగిన్ క్రియేట్ చేసేసి క్లిక్ చేసేసి మీ యూజర్ ఐడితో లాగిన్ చేయాలి. ఓకే, సో ఈ పాయింట్స్ నోట్ చేసుకోండి. ఎవరికైతే యూజర్ ఐడి లేదో, యూజర్ ఐడి మీకు తెలియదో, నోడల్ ఆఫీసర్ గారిని అడగండి. మీ పేరు చెప్పేస్తే ఆటోమేటికల్ గా వాళ్ళు రీసెట్ చేసేసి ఇస్తారు. సో ఫ్రెష్ గా మీకు లింక్ వస్తుంది. దయచేసి ఆ లింక్ తో మీరు పాస్వర్డ్ రీసెట్ చేసుకోండి. ఓకే, యా, గో హెడ్.
Thank you, sir. Now, after entering the user ID, username, we have to click on the login link button. Then system will ask for the password and the captcha display on the page. We have to enter here. Captchas are not case sensitive. We can use small as well as capital letter also, and click on the sign in button. After successful logging, user will get this home page, and on the left side menu we can see the different module wise we can able to see the buttons. So as per the roles provided by the nodal officer, user will get the buttons in the left side menu. For demo purpose, I have taken all the modules right, so I am able to open all the modules here. So first of all, we will discuss how the patient will get the registration from OPD counter, and then doctor can see the details of the patient on their under clinic module by selecting their rooms and clinic. So let me first I will register one patient in patient registration module. Just click on that module button. It will ask, module will open in separate window. Do not forget to log out from the module after finishing the work. Once you will allow it, with the click on the OK button, the module will be open on the separate window. Click on the patient registration link to expand all the available links under that. As per the roles and responsibility, user will get the links also. So using the new registration link, we will register the fresh patient who are coming first time in the hospital to generate their UHID. But the patient who have the UHID, we can use the search button to generate their revisit slip. Using the new registration link, we will get that form as per the configuration, as per the selection by the hospital. We have two types of registration templates, so the hospital can select it according to their use. Now, as sir already told that our application is integrated with the ABDM ecosystem, so we can register the patient in our hospital using the National Health ID. So we have a different types of methods to register the patient in e-hospital using National Health ID. The first button is e-hospital search. Using that, we can get the details of the patient, register patient details using their health ID number, UHID, and mobile number. Using that, we can able to search the patient who are already registered with this hospital. Just enter the mobile number, any one of these search criteria, and click on the search link, search button. The system will show all the previous registration has been done with this particular mobile number. So we can search the patient and click on the action radio button to proceed further. If it is already registered, then the system will ask, do you want to revisit? Then okay. So by default, system will redirect on the revisit page. Here we can get all the data, their National Health ID and the billing type, whatever details we have captured while doing new registration to generate their UHID. So the UHID will be unique within the hospital only. Unique hospital ID. So from here, just we need to select the department in which the patient wants to follow. After selecting the department, we will get the rooms as per the configuration. In the case of cardiology department, we have two rooms, room number 3 and room number 4, on which the cardiology clinic are running. So as per the user requirement, if the patient wants to visit in room number 4, we can select the room number 4. But here we are doing the load balancing also. First, if we will select room number 3, then for the next patient, the application will allow, will shift this for room number 4 in first from the right, from the left side. And also we can get the details, how many new patient has been registered in this room number, how many revisit, and total patient data. Then after selecting the room, just clicking on this button, it becomes a green. It means we have selected the room, then need to click on the save button. It will ask the pop-up. We can cross check the departments, the units, and click on the OK button to generate the OPD card. So we can get the OPD card. We have done the revisit. So the OPD card will be marked as a revisit. One token number we are generating for to managing the patient rush in the rooms. It is being generated room wise. How many visits this patient has done, that count also we are showing here, and last visited date. Then room number, already the UHID is available, the EHR ID is available. If the patient has been registered with the National Health ID, we can get the QR code will be printed on the OPD slip with the National Health ID details, like their 16-digit National Health ID number and the National Health ID. So once the patient will get the registration, then the doctor can view how many patient has been registered in their particular room. And for the fresh patient, we can use the new registration. For the casualty patient, we have a separate link to register the patient in casualty department. So by default in this page, only the casualty department will show in this drop down. Other department will be hide. So as per our structure, the hospital can mark a single department as a casualty department. That will reflect here only. The criteria will be same. Just need to enter the first name, the guardian name, the age. These are the mandatory fields, like the address line 1, and need to select the department and rooms. Let me register one new patient in my hospital, in demo hospital, with the minimum requirement. Then the next National Health ID options is Health QR scan. Using the QR code scanning device, we can So now using the QR code reader, we can read the QR code available on the OPD card and on the health ID card to get their data in this text box. So not need to enter manually. The next option is health ID validation. Here we have to enter the health ID or health ID number manually. Like this is my health ID. and marked at the rate NDHM. Give the exclusive consent for sharing health record using NDHM ecosystem. Then click on the search button. Here we get the two options to send the OTP on the registered mobile number. Using the mobile OTP, we can send the OTP, and using the Aadhaar OTP options, we can send the OTP on patient registered mobile number. After verifying the OTP, all the data will be filled in the respective fields. So now need to I got the OTP. Just verifying the OTP. All the details will be filled in the respective fields. The date of birth, the first name, middle name, last name. Just need to enter the guardian name of the patient. The address will be filled by default, the country, the state, the district, the PIN number, the mobile number of the patient. Then the health ID, we can see here, the health ID and the health ID numbers is coming from the NDHM site. Just need to enter the guardian name and select the departments and rooms to generate their OPD card. Then the last one option is shared profile. So it is also called the self-registration. So in this, we using this option, just need to generate one QR code counter wise and stick on the counters. So using the PHR app, patient can scan the QR code and share their record with the respective counters. So in this case, the OTP validation is not required. Just after sharing the detail by the patient using the PHR app, just counter person need to select their own counter and click on the search button. So whatever detail we have shared with this counter number 1, or how many patients has shared their details, though we will get the details here. Just need to select the radio button for the specific patient, and by default the data will be filled if the patient is coming first time. Otherwise, the application will allow to go for revisit if the patient has already visited and their UHID has been generated in the specific hospital. So there we will get the options of revisit in that case. Or we can register the patient manually also. We can enter the date of birth. We can pick the date of DOB from the calendar, or just we can enter the year. Guardian name. Address. These are the mandatory fields. And just click the department and the room on which we want to register the patient. And click on the save button and click on the OK pop-up button. Get the OPD slip. So as per the configuration, we have 5 types of slips. We just slips according to the requirement. Now these are the registration part. Once the patient get the registration, they will go for the clinic to see the doctor. So now we will start. We will show you the clinic functionality. So first of all, from the home page, we have to open the clinic module. Click on the clinic module button, and same process we have to do. Allow to open the clinic module in the separate window tab. So we will get the clinic module here. Now click on the clinic link module from the left side menu to get all the available sub modules and links. Now the first is OP consultation. So from here, the doctor can get the list of registered patient. Just selecting the clinic. First of all, I have registered one patient in cardiology. So just selecting the cardiology, as per the rooms the doctor is sitting, they can select their room and click on the next button. So they will get all the registered patient in room number 4. Currently, only one patient has been registered. We have registered in the room number 4. So their queue number is also coming. So all the list of patient we can see from the clinic also. So from here, just we have to select the patient for the further treatment by clicking on the select link. Then we will get the detail of the patient, like their UHID, the name, the gender, the age, and date of registration. If patient is new, then the new checkbox will be checked. If the patient is taking the follow-up, then the follow-up checkbox will be checked. Then 3 ways we can register the patient in clinic. Also, before that, we can capture the vitals of the patient, like height. It can be done by the clinic boy also, and the body temperature, and just click on the save button. So 3 vitals we can capture. Now we will discuss about these 3 registration methods. The first one is register and create access health record. Using that button, the doctor can register the patient in their clinic, and the system will redirect on the order entry advance page. In the case, suppose that the doctor wants to give some test for this patient, then they will prescribe some medicine after seeing the reports. In this case, they can use the first registration button. So they will get directly after registration, the system will redirect on the order entry advance page, from where they can order the investigation. The second one is escape registration and create access health record. In this, suppose that the patient visited in the clinic, and doctor seen that the patient not belongs from their clinic, then they can skip registration and give some tests. In this case, if using this button, also the system will redirect on the order entry advance page without registering the patient in cardiology clinic. The third one is only register patient to clinic. If doctor wants to capture the details of the patient, like the complaints of the patient in detail, then they can use this third one option, only register patient to clinic. In this, using this button, system will not redirect on any page. But once we will go for the treatment sub module, on every link under that module, we will get the same patient, not need to search again. So just I will show you using the first one link, registered and create access health record, in which by default system will redirect on the order entry advance page. We will get one registration number. Now the system is has been redirect on the order entry advance page. From here, the doctor can view the previous generated report of this patient using the lab consolidated report button. Here we can get the all previous results. Lab wise, we can search like 3 labs. We have the biochemistry, microbiology, and pathology. And also using the date filter, we can get the previous done report. In analytical form also, the comparison also we can get here. If the same test has done multiple times, so we can get the comparison also, comparison statistics also here. Then we can order the services by selecting the category and just clicking on the investigation. All the investigation category will reflect in the drop down. Like just I want to order some biochemistry test, so we'll get the biochemistry test in this list. Also, if you have created the package like the liver function test, the plasma glucose, we will get the package also. So not need to order single service. Just by clicking on the arrow button, all the sub tests of this package will be ordered. And also we can order the single test. We can search the service name, and by service code we can search the services. Just I will give one single service, albunium. And if the doctor is logged in with their ID, their name will be selected by default, not need to select again. So it depends on the designation. So if the user designation is as a doctor, then their name will be selected as a recommended by. Just need to verify observation medicine. We can give the remark here, overall remark that can be seen by the lab technicians, and click on the save button. After saving, verifying the order, we can get these options to print the requisition slip. So 3 ways we can print the requisition slip. Department wise, like for biochemistry, for the microbiology, and for pathology, separately we can print the requisition slip. We can print the consolidated requisition slip, or we can print the barcode. Let me show you the format of the requisition slip. So this requisition slip contains all the details, like requisition number, UHID, the patient demographic details, and order investigations, and the department and the doctor name who have prescribed the investigation. Same, we can print the barcode also if needed. And we can get the consolidated requisition slip in this format. So as per the requirement, we can use the requisition slip. Otherwise, we can skip it also. By default, using the UHID, the lab technician, the sample collection user can get all the order detail. So also we can use the paperless service. So we have ordered the investigation. So any other investigation also we can order, any procedure we can order from this order entry advanced page, like OT procedures. So it depends on the patient conditions, and just verify the order service. So this way, if we have used the first button to register the patient in clinic, we will get this order entry advanced page by default. Other than using the last one, just register the patient in clinic, we can capture the patient condition in detail under the treatment module. Just after click on the presenting illness, by default the registered patient, the current registered patient will be selected here. So not need to search the patient again. So we can capture the complaints here. Complaints can be captured in codification. So we can use the here we are using the SNOMED city compliance. So we can search the complaints from the SNOMED city. Like in the case of pain, we can get the suggestion drop down here: pain in ear, pain in lips, pain in tongue, etc. So as per the complaint of the patient, we can search the complaint and we can select from the suggestion drop down. Doctor can give their remarks on the complaint. And also they can set the parameters complaint in the different part. Like for presenting illness, we can set the different parameters as per the requirement. Like here, I have created one parameters, stomach pain. Under that, we can create multiple parameters. Like left abdomen, painful stomach, we can create the drop down value. So just need to select it. So as per the requirement, doctor can create the parameters for their own clinic. So it will, using the less effort, we can capture the patient conditions. Then just click on the save button. By default, the current date will be selected by the system. Then how to configure the parameters for this for these links? So from here also doctor can create it. Just click on the configure a specific template. From here we can get the selected clinic on which we have registered the patient. So not need to select the clinic. Just we have to select the purpose. Like we want to add the parameters under general examination, which is or under the complaint and under the history tab. So just we need to select it. Then group wise we can add the parameters. First of all, we have to add one group that will reflect in this drop down. Like I have created one stomach pain group. Under that I have added the left abdomen. So how to create the groups? Just click on the add new groups button, type the group name and click on the add button. The added group will reflect in this drop down. Now before adding the headers in the group, we have to select the group first from the drop down. Then we can add the header name under this group name, just clicking on the add new header button. So here just we have to enter the header name and click on the add button. The header will reflect then in this drop down. By selecting the header, we can set the parameters type here, the event, the findings. These are the types by default we are able to select it from the drop down. Then need to enter the parameter name. After entering the parameter name, then we can give the control type for capturing data. We can use the checkbox. We can use the text box. We can use the text area if you want to enter large data, large text. Then we can use the text area. We can use the sensitivity drop down for just a plus minus, and we can use the dynamic drop down by separating the values through comma. So it becomes a drop down value. And then click on the save parameters. It will reflect under the cardiology clinic. So this way we can add the parameters. It will help to capture the details of the patient under the clinic. So now from next tab we can capture the history also. History can be captured from SNOMED city directory. Like surgery, if patient have any surgery history, So I will type the surgery. All surgery related suggestion will appear in the drop down. We can select the values from the drop down. So not need to type all the things. And also it is a free-handed. We can type the history also and give the remarks and click on the save button. So under the presenting illness, the doctor can also able to view the all available previous complaints and previous history. So now I have captured the history. So previous history is also coming, and also it will show the date of capturing the history and the username who have captured the history. Just clicking on that link, it will show whatever details we have captured. With the date and time. So using the Snowmat city, I have captured the details. So previous surgery to be Virginia. So that are coming here. Also the remarks is coming in the bracket. Same we can see for the complaints. So from here the doctor can view the previous captured details. Now the next is physical examination. Under the physical examination, we have three types of examination. Like we can do the general examination, we can do the systematic examination, and we can do local examination. In all three tabs, we can get the we can search the examination using Snowmat city codification. So from here, whatever vitals we have captured while registering the patient in clinic, that are coming by default. For other vitals, we can capture the details like the BP, we can capture. Also, time-wise, we can capture the vitals of the patient. The respiratory rate should be less than or up to 45. Then the pulse rate of the patient. Heart rate. And height, according to height and weight. We can capture the examination by using the University diagram. Using the another examination method like systematic examination, we can capture the examination detail. Also, we can add the parameters for systematic and local and general examination one by one. Suppose that for systematic examination, if I will type pain, So we can get the suggestion drop down. From here we can able to select the values, pain assessment. We can give the doctor can give the remarks, or any nurses can enter the remarks, whatever remarks provided by the doctor, and save it. If we have created the parameters, then the parameters will reflect here. Now the same we can do for the local examination. From here also we can capture the detail of the local examination, like pain relief or any other. So as per the word we have typed, we can get the suggestion drop down. And give the remark. So these fields are optional. So as per the requirement, doctor can just capture the presenting illness. They can skip the physical examination. If they want to do the physical examination, they can capture the physical examination detail. So we can see all the previous details, like the whatever general examination we have done, we can able to view the details here. The previous systematic examination details we can view for this particular patient. The previous local examination we can view here. So it will help to treat the patient. So all the previous EHR, whatever details we have captured under the clinic module, that can be visible patient wise. Then the next link is allergens detail. If patient have any allergic detail, allergy with the medication, with the food, with the environmental and the bacterial, we can capture here with the value of mild, mild to moderate, moderate to severe, severe and fatal. Just by clicking selecting the checkbox, we need to select the values from the drop down. If patient have any allergens, then medication allergy details we can add here. If the pharmacy is running under the hospital, then we can get the drugs name from the pharmacy also. Whatever drugs name we have added, that drugs name will be reflected in this list. We can select the drug name, or also we can type the drug name here. It is free-handed. And click on the save button from the bottom. So we can get the message saved successfully. Then the next link is diagnosis. We are using here two compliance to capture the diagnosis of the patient using the SNOMED CT and ICD-10, International Classification of Disease. Using the 10 version or using the SNOMED CT, we can capture the diagnosis detail of the patient. So how to capture the diagnosis using the SNOMED CT? Just we have to type the diagnosis detail here, like fever, so we will get the suggestion drop down here. All the fever related diagnosis we can get here. So just need to select it. Fever of the newborn, fever after vaccination. So according to the patient condition, we can capture the diagnosis. Just after selecting the diagnosis, by default, the login user will be selected in this drop down. Not need to select again. Now we need to mark this diagnosis as provisional or final. So it depends on doctor. If the reports are positive, then we can mark as a final, or if suspective, then we can mark as a provisional. Then click on the save button. So all diagnosis detail we can get in the respective list here under the diagnosis detail. Also we can print the diagnosis, or we can delete the diagnosis from the list if any wrong entry has been done by the doctor and by the nursing staff. In the case of COVID patient, we can mark the COVID patient as a suspected, or we can mark as a confirmed patient, COVID patient. Another way, using the ICD-10, also we can capture the diagnosis. So here, locally we can search the ICD code 10, or from the WHO site, we can get the latest ICD-10 code. By words, we can search locally the diagnosis, ICD diagnosis code. Like for fever, if I will type fever and click on the search button, so all fever related codes are available locally, that will reflect here. Or by ICD-10 code, also we can search the codes and their definitions. So we can select the fever unspecified, and we have to mark as a provisional or as a final diagnosis, and click on the save button. So this way, if we are capturing the diagnosis, so we can get the reports of the patient diagnosis wise. So two diagnoses we have done here. Now we can go for the directly. Also we can generate the prescription if we are skipping the these links, like the presenting illness, physical examination, allergic details. These are not mandatory fields. Using the generate prescription, we can get on this page, we can get all the details, whatever details we have captured in the previous links, like the presenting illness, physical examination, allergic detail, diagnosis. These things we can able to view on the prescription page. The diagnosis, whatever diagnosis we have captured, the complaints, the general examination detail, the systematic examination detail, the local examination detail, and the allergens detail. Also here, the doctor can create the templates to generate prescription easily. So first of all, we will discuss about how we can create the templates to generate the prescription. Now we can see, sorry, for viral fever, I have already created one template in which I have included two medicines like amoxicillin and calpol, and one test like liver function test. So for all viral patient, if seems a viral patients, just we can order by selecting the viral template, we can generate the prescription with a short time. So not need to enter the medicine one by one, or if we not need to give the medicine for this patient, just we can uncheck it. If not need to give the liver function test, we can uncheck it and add another test, add another medicine to generate one separate prescription for this patient. If already we have generated the prescription for this patient, we can get the previous prescription details also. To create the template, we need to click on this create new template button. We have to enter the caption name through which we can able to select. The name will reflect here. Whatever caption name we will enter, that will reflect in this list. From here, after entering the caption, we have to select the clinic. It will be valid for the all clinic or for the individual clinic. So clinic wise, we can define the templates. We can add the drugs. Drugs will be visible from the pharmacy. So by the group name of the drug, we can search the medicines available in the pharmacy. We can give the quantity here. Suppose that 10. Advice BD, and add in the template. Same, we can search using the alphabetically or by the digits, and using the alias method also we can search the medicine name. The next is investigation. If we want to add some investigation for this template, we can select the investigation. Already these master data will be added, like the for under the biochemistry already I have added the medicine investigations, so that investigation we can select for the templates also by checking the checkbox and click on the save button. So one by one we have to add the information here. If any procedure we want to add for this particular template, so we can select the procedures also under the procedure section. So whatever procedures we have added under the OT procedures category, that will reflect here. So before creating the templates, these data are coming from the master data, whatever master data has been added by the hospital. Same, we can use the immunization services category and then any other services category. So after adding all the required details in the template, we need to save it. To saving the detail, actually I have enlarged the screen, so so then we will get the save template button here on the right side, the bottom. Just click on the save button. We will create the templates. After creating the template, it will be visible here under the available template section. So let me generate one template. And also one things I have missed, that using the pharmacy, we can able to search the medicine also by enabling this service. There is the two types of service, like the medicines available in a specific pharmacy. Just click on the OK radio button. The system will ask for the to select the pharmacy from the drop down, whatever service stores or pharmacy we have created under the inventory module, that will reflect here. Just select the pharmacy and type the medicine name here. So we will get the drop down, the available medicine, the starting with the starting words. Just clicking a double click on the medicine, it will be selected. Now need to give the dose and quantity here, or quantity. Then add the advice like BD, or sorry, OD for 5 days. And by default, as per the template, we have ordered the liver function test for this particular patient. Now we can already add the we have added the notes for this template that come after 7 days. So the notes are also coming. If need, we add the others, some more notes here, and click on the generate prescription button. In two format, we can generate the OPD prescription in A4 size or ticket size. As per the requirement, we can select. A4 size will contain all the details, whatever details we have captured, like the complaints, general examination, systematic examination, local examination, allergens detail, diagnosis, notes, whatever medicines we have ordered, prescribed, and the prescribed investigations. We can print the prescription and give to the patient. Now, for this patient, I have already created one prescription, so we can see the previous prescription details here also. We can print the previous prescription, and by selecting the previous prescription, we can do some change. If we want to remove some medicine or add some medicine on the existing prescription, we can generate new one. If the doctor wants to give the same test again while next follow-up, so using the previous prescription, we can generate new one with the less effort. So now we come on, we'll go for the next link, patient progress report. Using that link, for the individual patient, doctor can view the progress report of the patient, like the symptoms, whatever symptoms we have captured, using the treatment, using the parameters, and it will comes under the patient treatment details, the history of the patient, the general examination, systematic examination, local examination, the regions detail, the diagnosis, and also the vitals. Vitals can be seen in graphical representation. So there is a different tab for the body temperature. We can view the graphical representation for the body blood pressure, for the pulse rate, for the respiratory rate, for the health rate, for BMI. We can get the graphical representation. Whatever investigation we have given, it will contain all the history of the patient. So doctor can view the previous investigation, and if the report has been prepared by the lab department, so after verification we can get the view link here to view the report. We can view the already ordered procedures here. Whatever medicines we have prescribed using the pharmacy, so we can get the medicine details here also, and how many medicines have been dispensed by the pharmacist, that quantity also reflect here. So doctor can see how many patients, how many quantity the patient got from the pharmacy counter. Any other services if we are given for that particular patient, we can get the details also. So from here we can get the total details of the patient progress report under the patient progress report. Then the next link is OPD service entry or advance order entry advance. So we can use the order entry advance. It is the latest feature. So from here we can get the view of the report, view link to view the reports, lab consolidated report link to analyze the previous reports results with the new one, and also the doctor can view the status. Currently it is showing active, but after taking the sample, the status becomes will show the sample collected, date and time. Once the report will verified, then the status will change as a verified, and we will get the view link under this report column. Let me show you this part also. So once the doctor has been ordered the services and investigation, patient will goes to the laboratory sample collection center to give the sample if any investigation has been ordered by the doctor. So for that we have to open the lab technicians, or the sample collection users will open the lab module from the home page. So now the session has been expired, so I have to log in again. Same process we have to do for logging. Then click on the login button, then enter the password and the captcha. Click on the sign in button. So now from here I have to open the laboratory module to collect the sample of the patient. Under the laboratory module, we have a sample collection link. By selecting this collection center from the drop down, we can continue with the selected. Just need to search the patient through UHID. Click on the go button. So already we can get the details. How many services have been ordered by the doctor? So albumin and plasma glucose we have ordered for this particular patient. Just select the order service. If needed, we can give the specimen site from where we are taking the sample. By default, as per the configuration, the lab subcenter will be selected by the system. Just need to click on the save button. So once we'll click on the save button, the sample number will be generated and we can able to print the barcode which will be stick on the vials. Also, we can get the acknowledgement slip if needed. Then the lab technician can check the quality of the status by searching by getting the all generated sample, selecting the by lab or by using the UHID. Also, they can get from here. By default, OK is coming, but with the different values, the technicians can reject the sample also using the no sufficient volume, quality not good, sample damaged. Using these value, we can reject the sample. So the sample collection user center can able to recollect the sample again without ordering the service. If sample is fine, they will give one reference number and save it. They can give the comments also if needed. Or save then the reference number will be generated. Then the observation entry user can do the result entry for this particular service. We can search the patient using the UHID by selecting the lab subcenters. Just need to click on the go button. We will get the detail here. And by clicking on the sample number link, we will get the page from where we can able to add the observation details. If we have created templates for any service, we will get the template based entry options. Otherwise, we will get the without temporary based entry. We have to enter the value. If we not need to want to use the templates, we can do the template based without template based entry also. Fasting. Also, as per the configuration, the normal range will come here. So we can enter the value here 99 and PP is 200 and save the observation entry. Then the verification, next option is next part is verification. So after verification, we will able to print the report. So here we can get the sample number. Just clicking on it, we will get the options to verify the report. So also we can see the results if below and above the normal range, it will be highlighted. So the observation verification user have rights. They can change the observation entries here. But after verifying the reports, we will not get the window to change the observation result. If needed, in such case, in the culture, we need to enter after 24 hours the value the result value. So for that types of test, we can mark for review. So we will get the another link in this review verified lab report. We will get the window to change the observation entry after verification also. Just select it. If any verification is needed, comments is needed, they can give the comments and verify the reports. So we can get the value here. Just refreshing the page, we will get the status of this sample. So currently liver function test is active for this particular patient, and we can get the reports view options, and after verification done, we will get the status as a report done on date and time. Using the view link, we can get the report. The doctor can able to view the report digitally from the Ordinary Advanced page. Also, if they want to see the consolidated report, they can use this consolidated report button. They will get the consolidated report also. If the same test has been done precisely, so we can get the comparison statistics here also. So we can compare the new one result with the previous result. So this way, the doctor can give the treatment under the clinic module. Now we will discuss if from here we need to admit the patient in the IPD. So how we can admit the patient in IPD? So we have a separate module like admission, discharge, and transfer. So under that module, we have a different sub modules. Using the IPD admission, we can admit the patient in IPD by using this existing patient link. Here, just we need to enter the UHID of the patient and click on the show patient detail. So by default, all the details, whatever details we have entered while doing the registration, that will be filled by default. Just need to add some more details under the admission information section. If any add emergency we want to add, we can add also here, like just clicking on the add new emergency button, we will get the form here to add new emergency detail. Any attendant detail we can enter here, their first name and Kumar, relationship, friends, daughters, fathers, husband, others like friends, their address, and then we can give them mobile number. These are the mandatory field, and click on the add emergency detail. So now we have added the emergency detail of the patient as a attendant. So we can get the detail. We can add more attendant details also. Then we need to select the admission information. Here we can mark the patient as a MLC, medical legal cases patient, if the patient is a MLC case. Otherwise, by default, it will be selected no. Then we need to select the departments on which we are going to admit the patient. So after selecting the department, the available unit will reflect in the next drop down. Under the unit drop down, just need to select the unit. So whatever unit, whatever ward we have added under with this unit, that will reflect under the ward drop down. Then we need to select the bed type, beds. Then we can get the options to select the bed on which the patient will get the admission. So for here, for the admission process, we have two templates. One is RRR template, and currently we are using NDMC template. In this NDMC template, we have giving the rights up to bed level to the admission counter user. If the hospital are providing the beds from the admission counter, they can use the NDMC template. If the concerning ward will allocate the bed, then hospital needs to use RRR template. On that, only up to ward level the user have access. They can select the wards only. The other fields will be hide. So as per the requirement, hospital can use the templates. We have two types of templates for the admission. First one is RRR and another is NDMC template. On NDMC template, we will be able to select up to bed level and the teaching doctor also. If the bed is not available, we have a floor option. On floor, we can also admit the patient. In the provisional diagnosis, we can capture the COVID-19 confirmed case and COVID-19 suspected case, and also we can add the diagnosis here if available. After filling all the details, we need to click on that save and generate ticket button. So after clicking on that button, we will get the admission slip. So we have two types of slips. Currently we are using A4 size, and we have a ticket size also. It contains all the demographic details of the patient, like the treating doctor, the unit in which patient got the admission, the ward and the bed number. If we are charging some admission charge, that will be that we can configure and will be printed on the admission slip. After completing the admission, we are generating one in-patient number for each patient. We can get the emergency contact detail here and the patient's details, address and mobile number and other details. So which user has generated this, admitted the patient, that their operator's name will be printed and the treating doctor name will be printed here. So after admission, we need to treat the patient in IPD. So we have a separate module, treatment. The same link we are using as we have already seen under the clinic module, like the presenting illness, we can capture the complaints of the patient in IPD using by searching from the SNOMED city directory. If I will type pain, so the chief complaint region is due to pain. We have admitted the patient. We can give the remark and click on the save button. Same, we can capture the history. So all these details, whatever details we have captured under the treatment module, will by default fill on the notified discharge and discharge summary report. So not need to enter these details on the while doing the discharge. Same, physical examination, we can capture the vitals of the patient. Time wise, we can select hoursly and minute, and AM, using the AM PM, we can capture the vitals of the patient. Same, any allergic details patient have, that can be captured here. If any investigation we want to give this patient, so that can be ordered here, and the sample can be collected by the lab technicians, and after generating the report, we can able to view digitally from the IPD also. So the round doctor can view the reports digitally after verifying the report by the lab. We can capture the diagnosis using the SNOMED city or ICD-10, same as we have seen under the clinic module. Just need to mark as a provisional or final and click on the save button. Same, we can capture the ICD-10. Also by word we can search the codes. Just I will select anyone and mark as a provisional and click on the save button. So these detail, whatever detail we are capturing here, it will by default reflect on the discharge page. So not need to enter that detail again on the discharge summary report. Especially for the IPD patient, we have given the service cancellation option. If the sample has been not collected for the specific service, whatever service we have ordered from the for the IPD patient, let me order 1 or 2 service. So we can able to cancel that service. In this case, we are verifying here if the service has been not availed by the patient, they have not given any sample, then only the operator can able or anyone any user can able to cancel the service. If once we will collect the sample, then the under the action we can see here that we have completed the process of the sample collection and observation entry. So not we will able to delete and cancel this service. But for that service who are not currently active, for that we will get the action remove or cancel the service. The same as we have seen under the order entry advanced page, the same page is available with the IPD service entry link. So we can use that link also. Anyone from these two link. Both links are same. Just we have giving us another name like IPD service entry for the IPD patient or OPD service entry for the OPD patient. So what are not being used by the hospital, that can be removed from the admin part. Then the next link is search patient. From here we can get the details of the patient by their UHID or discharge date or the any part of name. We can search the patient by clicking on the UHID. We will get the detail of the patient. From here we can able to see the detail, the IP number of the patient, and admission number, the patient name, the guardian name, the relationship with a guardian, the address, telephone number if we have entered, the gender, age, relation, department, in which ward, and bed patient is currently admitted, the current status of the patient admitted on, who have giving the permission to admit the patient, the doctor name, and who will release this patient. Once we will release, the information will be will visible here also. So these are the treatment part. From here we can do the treatment. Also nurses can do the notes here. Ward wise they can use the notes. So for cardiology ward, just we'll select the cardiology, click on the show list. We'll get all the admitted patient list. Patient wise we can create the notes. Here the notes type can be an action, can be a doctor note, or we can select as a program note. Note priority we can set. It can be a routine or it can be a urgent. We can give the note name here. Entry date, by default it will take the current time and date. Click on the save button. Now under that note we can add multiple comments, whatever suggestions and the action provided by the doctor while they are when they were wrong, so that can be added by the nurses. So it will help to treat in patient treatment. So comment can be added here. After typing the comment, we can click on the save button. Comment will be saved and we can view the added comment. So this way we can create the notes also. Now we will talk about the next submodule, newborn baby. From here we can register the born baby details. We can generate their UHID and admit in the ward. So for especially gynecology ward, we are using this option. Then during the treatment, we need to transfer the patient from one ward or one department to other department. So for that, we have a transfer submodule. Under that, we have a bed allocation link also. If the hospital is using triple R templates, then the concerning ward need to allocate the bed. So using the bed allocation link, they can allocate the bed for the patient who are admitted in the specific ward. Just they have to select their ward, like just I will select the general ward. So currently all the no patient is available in the who have not allocated the who have not a bed. So the no patient is available in the queue. Already all the patients are admitted on the bed. By selecting the bed, just I will search for the another one. Now here for the medicine general ward, we can see one patient is available in the list without bed allocation. So from here we can allocate the bed. Just selecting the checkbox, we will get the options of the bed type and the bed number. Available bed number we can get, and also if the bed is not available, we can allocate the floor. So this way we can allocate the beds. Now next is transfer. How to transfer the patient from the from one ward to another ward, one department to other department, or one unit to another unit. So we have two types of transfer process. Using the first transfer, directly the patient got the transfer in the respective departments or units. So not in this using this transfer, the verification is not required. By default, the patient will be transferred. So we have a transfer type, like we can transfer the patient from one department to other department. We can transfer the patient under the department units if the department have more than one unit. So using the unit transfer type, we can transfer the patient from one unit to another unit. Then next one is ward. We can transfer patient from one ward to other ward, or within the ward we can transfer the patient from one bed to other bed using the bed transfer type. Another process is the concerning ward. The one ward can raise the request for transfer using the request for transfer link, and the concerning ward has to approve it. If after verifying the request, then the patient will be transferred in the respective ward. Otherwise, they can reject also. There is a cancel request option also. They can cancel the request. So according to the requirement of the hospital, they can use the transfer process here. They can directly transfer patient, and they can use the request two-level process, request for transfer and verify transfer. So after verifying the transfer, then transfer will be done. Then the last process is we have to discharge the patient from IPD. So we have a discharge module. Discharge can be done in the two level. First of all, we have to do the notify discharge. Under the notify discharge, we have a different type of discharge type here. Like we can do the normal discharge, we can do the door case entry, discharge on request, lamba, left against medical advice, absconding if anyone have missing from the neck, missing from IPD case entry, and etc. Then the last one is issue temporary death certificate. If any death has been any death is occurred on bed, so using that last option, we can discharge the patient from the ward first. Then that dead patient will get will reflect under the death module. From here we can do other activities like death case entry, form 4 generation, death case verification for the death patient. So before that, before using the death module, we have to discharge the death patient using this discharge type, issue temporary death certificate. Then only the patient will reflect under the death submodule to do other activities. Now, just we are using the normal discharge type. Just click on the next button. We have to search the patient. We can search through ward using the admission ID or using UHID of the patient. Just click on the notify discharge button. So now we can see here whatever details we have captured under the treatment module that are coming here. Like the pain in ear I have captured as a complaint, so it is coming under the admit for section. Then diagnosis we have captured through SNOMED CT and ICD-10 is coming here. Then if any service entry has been done for from IPD, we can add in the list from the list, so it will be printed on the discharge summary report. We can give the treatment in brief. It is optional field. The mandatory fields are condition during discharge, okay, advice during discharge, take rest, for example, and then we can enter the summary if any, but it is mandatory field. We have to enter some summary here. Then we have to select the discharging doctor name. The same doctor, the treating doctor can be a discharging doctor, or any other one doctor can be a discharging doctor for the same unit. Then we can take the surgeon detail in the case of procedure. Here we can get the we are able to view the bill settlement pending message. So we have a billing process also, especially for the IPD patient. We can do the settlement. So before settlement, we have to take some advance, and on the advance basis, we will give the services, and and at the time of discharge, the nurses and madam can say to the patient they have to do the bill settlement. Then only they will get the discharge summary report. So we are showing here the message like the bill settlement is pending. So for that patient, we have not done the bill settlement. They have to do the bill settlement from the billing counter. Then after generating the bill settlement, the madam can able to view the bill receipt number here. Then they can proceed further. They can proceed for the notified discharge or verified discharge option. So once we will notify the discharge, we can notify discharge multiple times before verifying the discharge. Also, we can get the provisional discharge summary report just clicking on the notified discharge. If we have done the notified discharge, we have to select the discharge type, anyone, and search the patient. So here we can get the print option to print the provisional discharge, and multiple time we can able to edit the details of the notified discharge. Now we have to verify discharge. So once we will verify the discharge, the patient will be discharged from the ward and their bed will be deallocated. So at the time of verifying discharge, we can change the detail here if needed. You can see the treating doctor details is coming. If you want to print the treating doctor detail on the discharge summary report, so it will be checked by default. If we not want to print the treating doctor detail on the discharge summary report, we can uncheck it. Also, we can give the next visit date and click on the discharge and print certificate button. So the discharge summary report will be generated. It contains all the demographic details of the patient, their admission ID, their drug allergy allegiance details, whatever service they have availed during the ward, admitting in the ward, that will visible here. Their observation entry details, results will be also printed on the discharge summary report. So all things we can be able to view here: the diagnosis, the ICD code, the admit for region, the physical examination, and condition during discharge. So this way we can do the IPD clinical, we can capture the patient's IPD clinical data. If anyone have any query and any questions, please ask. Sir, any participants have any doubt, any query in these modules, like the clinic module?
So Vijayawada GH video
Not
video
visible.
not visible, not clarity visible. Vijayawada GH 1 hour 2.
As the shared screen is not visible to you,
Yes, sir.
Yes sir, yes sir. Clarity net.
it's coming now.
No, sir.
No sir, no.
Maybe
Clarity no.
maybe there is some bandwidth issue.
Blur, blur. Visible blur.
Now it's clear. Just
no
I have
clear sir. Sir, no clear.
okay. Actually, I have zoomed the screen. So
1 hour 2 video not clear sir. Vijayawada GH.
not clear.
Clear, not clear sir. Blur. Video is blur.
Sir, maybe due to some bandwidth issue, you are getting the image delay in image.
ఫిలిం కనపట్లేదు
కొద్ది కనిపిస్తే అసలు దగ్గర కూడా కనపట్లా రాజు గారు
Hello. Hello.
Yes.
Excuse me, sir. Sir, the
Yeah.
video is not visual, sir. It is very poor video.
Let me off my camera and see it is visible to.
Yeah, I can see. On the mic on this. The visual సరిగా లేదు. Yes, sir.
Hello.
National one. Yes, sir. Why can't you answer? Sir, excuse me, sir. Hello? Hello?
Hello.
Hello? Hello? Sir, is it audible, sir?
Yeah. Yes, sir. You are audible. Please.
Sir, that is it not visible, sir? Sir,
Sir,
poor video.
please.
Sir, the video
Sir,
is very poor, sir. We can't able to understand.
Sir, please check your internet bandwidth. So,
Sir,
for the
internet is
image,
okay, sir.
no,
Sir,
all other participants are able to see the screen clearly.
okay, sir. Sir, one more doubt.
Yeah, please.
So do you have this separate module for obstetrics?
It is a sir clinic.
This is clinic service because the delivery services and other things they need separate form of documentation.
Okay, no, sir. We have just a clinic module for the treatment purpose.
Okay, in treatment purpose only for when the patient comes for delivery and other things or monitoring and other things findings will be different.
Okay. Sir, after delivery, we have a system to register the baby, but
Okay.
for the gynecology patients, we
For
if you want, yeah.
during the delivery we have to monitor the patient and other things. So do we have that module here?
No, we have a common module, sir. So using the parameters, if you want to capture some extra detail for the delivery case, so you can create the parameters for the gynecology departments, especially for the gynecology departments. So
So
it will
mine
help.
is a separate hospital, obstetric hospital. There the monitor will be different and recording will be different for delivery patient, like partogram something.
Okay.
So the
So
national
So that part we have to see, sir, how many parameters and what types of details you are capturing for that particular clinic. If it is possible, we can configure the parameters, so it will be easy for you to capture the details
yes,
of
sir.
such patient.
Okay. In newborn care, you have written that is CR number. What is that CR number, sir?
Yeah. Actually, in the case of newborn baby, we are clubbing the baby with the mother CR.
Yes.
Okay,
Okay.
just registering the baby. But when the baby will got the admission in IPD in the specific ward and any pediatrics ward and the nursery, they will get their own admission ID. But it will on the admission slip their mother CR will be printed. Is it clear, sir?
Okay, sir. Okay. Thank you, sir.
Is there any separate cases, sir?
Sorry, sir.
So for MLC cases, is there any separate numbers, sir?
Yeah, actually, we are marking the MLC as a MLC,
Okay,
right? So first of all, the MLC case will be defined from the OPD counter, the casualty counter and OPD counter. There, we
okay,
have a MLC checkbox under the options button, and just just selecting the MLC, we will get the option to enter the MLC number. So manually we have to enter the MLC number, which is being recorded on the register.
okay.
But automatically we are not generating MLC number.
Sir, what about AR, sir, accident register? Is there an option
Sorry,
to
ma'am.
create a separate number or accident register?
I think, ma'am,
MLC told, sir,
ma'am, the
MLC, non-MLC.
yeah.
But
Actually,
what
ma'am,
about AR, sir?
currently, yeah, ma'am. Currently, the MLC number being generated by the I think police department. So the department is really currently existing in the hospitals. They are providing the one MLC number that will be entered by the operator while doing the registration. They can give one MLC number, so that will be printed on the receipt, on the OPD receipt.
Sir, I'm asking about accident register we are maintaining. Is there any separate number for that or not? Is there an
No,
option?
ma'am. We are not automatically. We are not generating any MLC number. We have to enter manually. So you can maintain the register.
Accident register, sir, I'm asking.
Yeah, ma'am. Also, the accident case can be considered as a medical legal case, right, ma'am.
Yes.
Right. So you have to maintain that register. We are not generating any numbers, MLC numbers from the application.
Okay, sir.
Just we are giving the window, the options where you can enter that accident number as a MLC number.
We did it as a MLC also, same.
Yeah, right. The both are same, ma'am. Both are same, I think.
If brought dead,
That option is that option is available. Let me show you. Under the casualty department, we have an option brought by date. Let me check. The section has been expired. Let me reopen the module. Screen is visible, ma'am.
regarding postmortem, sir.
Sorry, ma'am.
Regarding postmortem.
No. I think postmortem related details are not available in our application. So we can mention on the discharge like under the summary. So at least we have to discharge the patient. First of all, we have to admit it. Suppose that during the admission, patient got dead on bed. So we need to do the death case entry for the patient. Under that, we can give the postmortem details.
Okay, sir. Okay.
Okay.
Sir, excuse me. Sir, I'm Dr. Bharti, sir.
Yes,
Sir,
ma'am.
if you can increase the font size, the last benches people also can visualize, sir.
Let me. It is fine, ma'am. Now it's fine.
Some more, sir, because we can scroll the bar. Yes. At least if this much is there, the last benches can see, because they are not able to see, only hearing. They are not. Some people telling they are not able to see anything.
Okay, ma'am. From your end, just you have to double click on the screen, so it becomes a zoom.
Okay, sir. Okay. Thank you, sir.
Thank you, ma'am. So, as per the ma'am query,
Sir.
from the
Hello,
casualty
sir.
counters, yes, ma'am.
Hello.
We can mark.
Hello, sir.
Yeah, ma'am.
Hello, sir. Sir, I am a surgeon. We are sometimes representing the which area is affected, right side, left side, either in hospital or in general surgery, right lobe or left lobe, like that. We are diagrammatic representation. We are mentioning in the IP and also in the OP, sir. For that, any option is there, sir?
No, currently, ma'am, we don't have like a graphical representation, but for the
Yes,
right
sir.
left we can add the parameters,
Yes, sir.
especially
We
for the
want that
surgery clinic.
option also, sir. We
Yeah,
want that option also.
currently
Sometimes,
diagram is not available. So with the specific clinic,
okay, sir.
but you can add the parameters that are available with the
We,
different default values.
sir, you showed that pulse, BP, etc. graphic representation, sir. Like that, if it provided in the case sheet diagrammatic representation of diseased part, it is very good for the patient to avoid the confusion, sir.
So no ma'am, for the vitals it is available. Are you want for disease?
Yes, sir. In after we are operating right eye and you are labeling as right eye to confusion, avoiding confusion, sir. Like that in surgery also, thyroid right lobe, left lobe, right side hypochondrium, left side hypochondrium. Like that, you are marking in the case sheets. That option is not. If you provide that, it is good, sir. Like graphic representation.
Okay,
Thank you, sir.
thank you for your suggestion. You can send your suggestions also, so ma'am, it will be more clear for us. So if you give the complete structure for the surgery department, so we will try to
Thank you, sir.
do it this way.
Thank you, sir.
Thank you ma'am. From here we can mark for the dead patient, brought dead, yes, and brought by option also we can select. It will brought by the PCR or other or any relatives or by the police, and give the details in the case of brought dead. Anyone have, sir, any other query?
Don't want to comment on it. Actually, if they are connected in this network, then that is what you're saying is nothing. Whereas when it is connected from the server, then that point may not be affected because it depends on our pipeline. We have a pipeline for us. So when it comes, that bandwidth, whatever is there, that will have an impact on the distance what we are getting. So the clarity.
Sir, Usman sir, can we leave, sir?
Sir, I think from Usman sir's side there is some technical issue.
Sir, Rahul sir, can we exit now?
Yeah, if you have any query you can ask. Otherwise, we have completed the total workflow of our clinical module. So from anyone have any doubt?
Hello, Rahul sir. GH Visual responding. Usman sir.
Yes, sir. Yes, sir.
My medical superintendent, Mr. Y. Kumar, wants to talk to you from Vijayawada.
I think Usman sir, from Usman sir side there is some issue, sir.
No. Actually, thing is, we are not getting the network up to the next page, sir. Actually, because even though images we cannot see, image it is coming out with blur vision actually. Because might be some transmission problem, so my medical superintendent wants to talk to you. Sir, wait.
Hello. Hello, I'm Dr. Kumar, Superintendent, Government for Vijayawada. The relay is not good. Both the audio and video totally blurred images we are getting, and the doctors and they are almost all dissatisfied with the transmission. I think it is some technical problem from the server. So try to correct the problem, sir. Better. So Usman sir?
No, Usman is not there, I think.
Okay. So definitely it is a problem with the transmission from the Delhi, sir, not from the local problem. Even cell phones were not getting a quality displays. Especially words, they are not at all clear. Total clear and academic
Okay, sir. So can we bend up the sir session? Okay, sir. Thank you for joining the
Rahul sir.
session. Yeah, please, sir.
Sir, we are GH from Vijayawada, Andhra Pradesh.
Yes, sir.
My medical superintendent wants to talk to you. Please kindly be online.
Sorry, sir. Your voice is.
Hello, I'm Dr. Kumar sir from Vijayawada, Andhra Pradesh. Government General Hospital.
Sir, your voice is not coming clear.
Okay. Hello.
Yeah, please, sir.
So we are not having a very good display from the Delhi. There is a lot of blurring. Totally the videos and what matter is blurring. Nobody is not able
Sir.
to read the things also.
Sir, maybe due to bandwidth, you will get you.
There are blurred images, blurred things they are coming, and all the doctors they went away from the room also.
For other participants, the screen was clear. Sir, are you using the big screen or it is a small screen, sir? Are you using the projector?
It is not the problem with the projector or I think it is from the server. It is not coming properly. Yesterday we have not have this problem, but today totally it is.
No, same tool or sir, same recipe we are using.
They are coming. No clarity in the words or photos, videos.
Okay.
Sir, చెప్పండి.
No, no. Currently, we have off our video. So actually, I am able to view your videos also, but from my side, the video is also not clear from your side.
Yes, sir. Team పంపిస్తాను. ఇప్పుడు సెట్ చేయాలి.
Sir, can you check the video from Vijayawada?
అయిపోతున్నాడు. లేకపోతే అంబులెన్స్
Rahul sir, can you check?
ఏమవుతుంది మాట్లాడమంటారా? మేడం అదే మేడం ఇప్పుడు పీడియాట్రిషియన్ గురించి చెప్తా ఉన్నారు, ఇంతవరకు మీకు చెప్పలేదు. అందరినీ అది ఎవరెవరు కావాలో చెప్పండి మేడం, మేము పంపించడానికి అంత రెడీగా మీరు ఎవరెవరిని పంపించాలో చెప్పండి మేడం. కనీసం మెసేజ్ పెట్టండి. ఎవరినో వాళ్ళని ఎవరెవరు కావాలో చెప్తే వాళ్ళు పంపిస్తాం. బేసిక్ థింగ్ కదా మేడం, మళ్ళీ పీడియాట్రిషియన్ ఆయన లివర్ గ్యాస్ట్రెంట్రాలజీ, కార్డియాలజీ, ఫిజిషియన్ పంపించమన్నారండి. సర్జన్ సర్జరీ కార్డియాలజీ
సెట్ చేసినట్టున్నారు ఇప్పుడు. సెట్ చేశారు.
చెప్పండి జగన్మోహన్ గారు చెప్పండి. ఆయన తర్వాత ఒక ఫిజిషియన్ చెప్పండి, ఒక సర్జన్ సర్జన్ ఒకటి చెప్పండి. కార్డియాలజీ కానీ కార్డియాలజీ స్లాబ్ పర్లేదు, ముందుగా మన రత్నగిరితో మాట్లాడండి.